Of the 94 cases, 26 are epi-linked, which is 31%. 65 are community acquired or community spread, which is 69%. And 49 people have recovered, which is 52%. Currently, there are 13 people hospitalized at a Hamilton County hospital with a confirmed case of COVID-19. 20 additional persons, PUIs, are under investigation. They are also hospitalized. Remember that these are not necessarily all Hamilton County residents. You can visit our website at health.hamiltontn.org for additional data, points, and demographics, and our website is updated daily. I want to remind the community that our drive-through testing site is open and receiving referrals from healthcare providers. We did 51 tests yesterday. If you are experiencing symptoms like fever, cough, or shortness of breath and would like to be tested at a testing site, this is the process. Call your healthcare provider and let them know your symptoms. Ask if you should be tested at the testing center. If the healthcare provider determines that a test is recommended, they contact the health department directly. Only healthcare providers and their office staff can make that referral. A health department scheduler will then contact the patient and schedule an appointment time. The scheduler will also give the patient important information about their arrival at the testing center. Patients will arrive at the testing site at their designated appointment time, go through the specimen collection process, and specimens then go to our Hamilton County lab at Baylor School. The healthcare provider will get results back within 24 hours, and the healthcare provider will contact the patient and notify them of test results. If you need testing and don't have a provider, you can call our hotline for a provider referral. Or if you have other questions about the process, please call our Hamilton County COVID-19 hotline, 209-8383. Also, if you are an employer of essential services such as grocery stores, pharmacies, and you have sick employees, you can get them tested at this site as long as they have a provider referral. A negative test will allow them to get back to the work in your workforce faster. I'd like to also mention a concern that local hospitals have expressed to us. They have told us to stress that people who need emergency hospital services should continue to seek that care. Hospitals continue to see emergency cases for people who do not have COVID-19 symptoms. Postponing such care can lead to very serious unintended health consequences. So for more information or questions about COVID-19, please call again our hotline, 209-8383, or visit our website. Now, Dan Walker, our epidemiologist, is going to show you our latest data that we're able to share with you, our heat map. Thank you.
Thank you, Becky. Again, my name is Dan Walker. I'm the epidemiologist for the Hamilton County Health Department. One of my tasks as an epidemiologist is to coordinate the mapping of positive COVID-29 infections in Hamilton County. We do this by using the case's home address. This heat map represents the density of COVID-19 cases in Hamilton County. You can see here in the hotter areas are at the bottom of the map and at the top of the map. That is because there's a higher density of population in the southern part of the county. But what is more important to note is that there are cases across the entire county. That's why it's important to maintain social distancing and remain at home throughout the pandemic. Thank you.
We also want to remind folks to, during this time of social distancing, to always remember to wash your hands and to keep your hands away from your face, your eyes, your mouth, and your nose as well. Continue to do so. If you have to get out in public, you need to go to the grocery store, you need to run some other errands that are essential during this time, please make sure that after you leave that you continue to sanitize your hands, whether it's with hand sanitizer or washing your hands with soap and water. We also want to inform you that today the hearing impaired personnel are going to be social distancing themselves, and the video will be uploaded after the conclusion of this press briefing. And now at this time, we're going to do the same process of answering questions through the WebEx. So who is up first? Sarah Grace from the Times Free Press, your question?
Thanks for sharing the location information. Can we get a copy of this map digitally? And also, if somebody can explain what the threshold that made you guys decide to share this information was.
We can, you want to address that, Dan?
Sure.
Okay.
So thanks for the question. And I think your question is, why haven't we released this heat map sooner? And the answer to that is because we're trying to protect people's identities. And we've gotten to the point now with enough cases that we think we can show it without clearly identifying any patients.
What we'll do is after this press conference, those that need it, just email Tom Bodkin at the Hamilton County Health Department, and he will provide you with that map. Shannon Sharp with News Channel 9.
Hey, my question is for Becky. You mentioned that hospitals were stressing that patients who were experiencing emergencies to still come to the emergency room, even though they may not be COVID related. Can you elaborate a little bit on that?
Well, other than just that the hospitals on a conference call said they had some experience where people who needed to come to the emergency room either was afraid to come to the emergency room or perhaps thought maybe that the emergency room was only doing COVID-19 related patients and didn't come, and it had unintended consequences.
So, for instance, if people are feeling like chest pains, that kind of stuff, they should still seek out emergency care. Are there any other instances that you would encourage people to seek out emergency care, even in the midst of this crisis?
Absolutely. Certainly, I mean, broken bones, you need to go. I mean, if you're having gastric bleed, you would need to go. I mean, there's, the multitude of things that you normally would go to an emergency room, you still need to go.
Sarah Grace, you're up again with Times Free Press.
Yeah, I was just wondering if you guys could specify. Oh shoot, I lost my place.
Someone else?
Sorry, I think.
Did you find it, Sarah?
Can you hear me?
Yes.
Okay, sorry about that. You said that there's information available for people who don't have primary care physicians through the hotline, but I actually had called the hotline earlier today after we heard that, and 2 different representatives told me there was no such list. Is that information available online somewhere, or how are you guys keeping the hotline workers up to date with this information?
Sarah, make sure you're talking into the microphone. You're going in and out, so we're hearing part of your question, but not all of it.
Can you hear me better now?
Yes.
Okay, my question is, how are you guys keeping hotline workers abreast of new information? Because we've heard things publicly that the hotline should have that we've been able to talk to hotline workers and not get that information. Specifically, I'm talking about the list of providers that you mentioned earlier in this press conference.
We do have a list of providers that will have agreed to see people without insurance and with, that would need possibly reduced pay for their visit. And if you had an experience where our hotline did not give you the information you needed or accurate information, I'm really sorry, and we will follow up with that. Information changes quickly. Sometimes providers are on the list for a while, and then they may not be taking, additional new patients. So it is a constantly changing process, but we will follow up to make sure our hotline providers have that accurate list. Thank you.
And it looks like we have one that's raised hands. Shannon Sharp, are you still needing to ask a question?
Yes, I had another question. I just wanted to clarify there were no additional deaths in Hamilton County to report. I didn't hear that number.
Yes, that is correct.
Okay, thank you.
No additional deaths.
Okay, that's all the questions. Thank you so much for joining us today, and we will let you know when additional media briefings are to be scheduled in advance. Thanks. Have a great day.